The Prime Minister is blaming care home owners now for the large number of deaths, over 20,000, maybe 30,000 in care homes. On the one hand, this is part of a pattern of blaming anybody but the government. As we've seen throughout this whole emergency, the unwillingness of the government to take decisive action at the right time, in contrast to what they've said they were doing, which was to follow the science in a timely and proportionate way, which is not what they've done. But actually, it's a bit more complicated than that, this care home situation, because in many ways, the care homes were let down by the failure to ramp up large-scale testing and to test both care home residents and staff from an early stage so that we could see what was going on and to provide adequate personal protection for them. On the other hand, there is an issue with some of the care homes and the owners, and this sector of care homes is quite complex and it's fragmented into different segments. So about half of it seems to be parts of large chains that are funded by private equity. Often their home is in the Cayman Islands. Their business plan is quite complex, where their margins are being made out of lending themselves money and paying it back at high interest rates, and they don't have any real loyalty to the business that they're involved with. And those care homes are characterized by low wages, not paying sickness benefits to the staff, not tolerating sickness absence so that people may have gone in when they were carrying the virus themselves, and staff being moved around in the cities between different branches of the same care home network. So in that sense, the Prime Minister is correct to point the finger at some of the larger chains. On the other hand, what we've seen with the smaller family-run businesses, where you might have a family owns one or two care homes and where the staff are immensely loyal and dedicated and committed, and many of them went and lived in the care homes to be with their residents. So with the smaller care homes, the infection rate seems to have been less than with the chains, so that across the whole sector of taking all the care homes together, about 40% of the care homes seem to have had infection. But if you look at the chains of them, the ones that are owned by corporate capital, investment capital, then it looks as though the infection rate in those care homes may be as much as 2/3. So I think in a sense, the Prime Minister is right to raise the issue, but he needs to point in the right direction. And the right direction is himself for not getting a grip early on. The right direction is with the failure to adequately plan for personal protection and to ramp up the testing. And the finger pointing needs to probably include as well some of the larger chains whose employment practices are unacceptable. The care home vulnerability has been known since Operation Cygnus in 2016, when it was flagged up then, that this along with supplies of personal protective equipment was identified as a weakness but never followed through. The directors of adult social care as a group, as an organisation, drew attention to this last year and nothing was done about it. So to say that this was not sorted out is not true. And then we've had also the Secretary of State, Matt Hancock, said that they'd put a protective ring around the care home sector from the very beginning. And that clearly is just not true. The care home sector was left. They didn't know what was going on. They weren't getting PPE. And then more recently, when the government has been trying to put a good spin on the number of tests being done, apparently some care homes have reported that they asked for 100 tests and they've received 500, which was more than they needed, a lot more than they needed. So they've never gone used. So when you look at the figures for the testing that's going on, and where over 20% have never actually been used, then some of that's probably coming from what's been going on with the care homes and the massaging of the figures there. occur. I'm afraid the game playing with the numbers is very difficult to follow. I find it very difficult to follow, and part of my trade in hand is numbers and statistics. We sort of suspected at the time that this thing about the 100,000, which suddenly magically happened over a 48-hour period and then didn't happen again, and when we began to realize that they were talking about the capacity initially rather than the number of tests, and then they fell back onto the explanation that it was the number of tests sent out and it didn't necessarily have been carried out. And now we're learning that people who are being tested regularly, which is happening with the staff of care homes now, may be counted multiple times. And the real number that we need to have is the number of people who are tested rather than the number of tests which are carried out. And this is all bound up as well with the ending of the daily press conferences, moving towards weekly reports, reporting on different numbers so that it's very difficult to follow exactly what we're being told. And then, we're going to be moving shortly to an American-style press briefing that we see from President Trump in the United States, where there's a professional briefer who will give daily briefings to the press and really puts the politicians at arm's length from their own responsibility. So we've seen a process of beginning the press conferences later in March, those press conferences becoming more and more stage managed, the journalists who are allowed in being highly selected, the questions being vetted, and then moving away from that, dropping the press conferences. And currently they are looking to appoint this person who will in future be the kind of propaganda face for the government. I gather they've now decided they're not going to release daily statistics. I think this is about getting the stories off the front page. It's about reducing the whole profile. It's about crowding the news out with other things that are going on during the summer period. And it's going to be interesting to see how that runs, because this time of year, we're moving into the period from a news point of view, the silly season, where strange stories can get big coverage because there's not much going on otherwise. And we'll see what gets into the front pages now over the next 4, 5, 6 weeks during the summer school holiday period. When it comes to the BBC political correspondent making a story out of the Prime Minister having a haircut, you can take this of one of two ways. This could be that they've been totally sucked into the inner sanctum and brainwashed, a kind of Stockholm syndrome, if you will, have gone native with the political party that's in power. Completely trivial story, avoiding the fact that 65,000 people are dead, and probably more than half of that number, it was avoidable. So you could take that interpretation. On the other hand, it could be that this is some kind of desperate signal of somebody who's been held captive, and she's trying to get a message out to the outside world not to take her seriously. I mean, when you look at the scenes of large numbers of people, younger people, out and about, after a few drinks, social distancing becoming meaningless, we know that at that age, people's social life is so important to them. And what we haven't done is try to find ways of making it safe for them to carry on with their normal life. And I've argued over and over again over the last few weeks that we should have been offering testing for people who are out and about so that they could know what their status was and they could isolate as necessary, but otherwise carry on to some extent living a normal life, but respecting the social distancing. What we've seen here is a very cynical approach from government, which has created all of the conditions when the virus can spread again, and then be able to blame the public and individuals for not doing the right thing. I think we trace this back to the embarrassment that the government suffered over Dominic Cummings and his trip to Barnard Castle to get his eyes tested. And the fact that this really showed up the hypocrisy of the country. Since that time, they've just been muddying the waters so that it didn't seem as though it was anything to do with them. And this is very much in the Cummings and Johnson playbook of not taking proper decisions, letting it all hang out. They've said to the general public, look, you all were clamouring to get out and back out into the pub. You do that now, you get on with it. If anything goes wrong, it's your fault, it's not our fault. In the same way, they've said to the local directors of public health, you've been saying you want to do the testing. Here you are, you get on and do your bit of the testing and tracing. By the way, we're not going to let you do all of it. The lion's share will be done by these corporations nationally with Deloitte and the Serco. And if they get it wrong, well, that's just tough. It's not our fault. We've outsourced it to these companies. We've let the directors of public health get on with it. It's not me, Gov. It's not me, Gov. This should be Boris Johnson's real slogan. It ain't me, Gov. That would be his proper epitaph. I think one of the saddest and most cynical things about the last few months has been the way in which this spontaneous action of clapping on a Thursday night to support the NHS workers was co-opted by the government and taken as a cynical kind of measure of support for itself in the way it was handling the emergency. I think the general public realised that. I hope that they remember that when this is over, because we really all continue to value this national treasured organisation so much and all those who work in it, and some hundreds of them who've given their lives or had their lives taken from them because of a failure to protect them. The cynical withholding of the £10 billion that the NHS needs now to cover the deficit that's come from the work they've had to do over the last 4 or 5 months, it has to be looked at with a cold eye to see what that's about. What we are now going to have is large waiting lists for things like hip and knee replacements and other kinds of things, but also for cancer treatments and other important matters. And not having an NHS which is properly funded will push people into the arms of the private sector. So I think what we're seeing here is cynical opportunism to grow the private sector out of this emergency. And I think the proposal to pay £5 billion to private companies to run large-scale testing really bodes ill when that money should be being invested in local public health to rebuild the public health system. And for me, my fear is this is the first step in privatising the British public health system. You know, we need to be alert to what's happening behind all the smooth words and the bluff and the bluster and the focus on Boris Johnson's hairstyle. I think many people of goodwill and of politics that are different from mine may have got carried away with this thing about shrinking the state that's been pushed as a form of ideology over the last 20, 30 years. Now that people have experienced this and they've seen what's happened to loved ones, elderly loved ones who've died in care homes from middle-class backgrounds, from wealthy backgrounds, as well as from poorer backgrounds, once they've seen the cynicism of this lazy and narcissistic Prime Minister, then hopefully they will realise how important it is to have a strong state presence in public services. Yes, public services always need to be kept an eye on. They need to be strengthened. They need to be reformed. They need to be accountable. But, you know, my tax money, I want to know it's being properly spent, and that's reasonable. But I don't resent spending my money on public services. It's what makes me feel as though I'm part of the society I live in. What this pandemic has revealed is the cracks in our international systems, in our governance arrangements for biosecurity, the weakness of the international agencies not being able to enforce public health measures. I mean, the WHO has to work by influence rather than by drawing down statute. And we've also seen these business sectors. We've seen the care home sector, we've seen the abattoir, the meat industry, which is controlled by small numbers of very powerful people, often with quite dubious connections. We've seen now the same thing with the instant fashion textile industry, with the sweatshops, that we've tolerated practices which place us all at risk. And this is very much part of the agenda of those who call for small government and deregulation. This is part of the tabloid war on health and safety that will make a mockery of safety measures and reduce it to some kind of discussion about not being able to have conker fights because the conkers are dangerous on a bit of string outside the school gates, when what we're talking about is the deaths of people's fathers and mothers, sons and daughters in the workplace, and the transmission of infection from people working in totally unsatisfactory conditions in decrepit back rooms in Leicester and other parts of the country. Well, let's talk about masks. Here I have my face covering for going to the shops. Here it is. That's my Lone Ranger gear. But according to some commentators, English males are too fragile to wear masks. The male identity won't carry it. It's too difficult. But I think it's another one of these things where the individual behavior is one aspect, but the individual behavior not being supported and reinforced by the role models, by the leaders, whether they are wearing masks, whether they are wholeheartedly supporting them, is the key issue. We know now there's increasing evidence that the countries that have really had very few cases or very few deaths are countries that really subscribe to mask wearing. And I think when this is all over, we're going to have some very interesting data from this natural experiment of looking at mask wearing countries compared with non-mask wearing countries and the sort of outbreaks that are happening. I see there seem to be outbreaks associated with a number of pubs at the weekend. Pubs seem to be a very good place to spread the virus. It's interesting that after his initial opposition to masks and to his attitude towards the collection of people in mass gatherings, the chief scientist, Patrick Vallance, has now been saying that pubs are really an ideal place for the spread of the virus, which is interesting. I mean, this seems to be different to the attitude that he was taking earlier in the epidemic. So goodness knows what this is going to mean. The other thing is that now there seems to be increasing concern from scientists about aerosol spread as opposed to just spit and globule spread from coughing, that with an aerosol, smaller particles with virus in, they can carry much further than bigger particles from a cough or an ordinary sneeze. That's why I think we've seen reports from parts of the world where quite a number of choirs have had outbreaks in them, where people singing, filling their lungs, exhaling, producing aerosols, spreading the virus. And this whole thing about how we've decided to ease off the spacing distance from 2 meters down to 1 because of the economic side of that may well turn out to have been a very short-sighted measure. Now, we don't know what's going to happen with this virus. We still don't know what's going to happen now. I mean, we can see it's quite worrying from other countries how it's coming back in Melbourne, in New Zealand, in Spain. We've seen in Germany in the abattoir setting. This virus has not gone away. We really need to be very careful. I believe we have eased off the lockdown a month too soon. We should have tried to squash the Prime Minister's sombrero flat before we eased off. And that's what the Scots have been trying to do. They've had no deaths now for a few days. And if we did that, if we squashed the sombrero flat, if we had the adequate levels of testing being delivered by local public health teams who know their communities, then we would be in a position to ease off and to really get to grips with any outbreaks as they occur. But now, after last week in Leicester, what may happen is we may have a whole series of quite large outbreaks and we may struggle to get on top of them again. Well, this virus is now gathering momentum in the southern hemisphere, in developing countries. In India, it's now really seems to be pretty well out of control. This world is a small place. We've eased off the flights. The flights are happening again. And as we saw with that very first case of the businessman in Brighton, people don't necessarily travel in a direct line from A to B. People move around the world in complex patterns, and people will be coming into Europe, people will be coming into the UK in different ways. People from the UK will be traveling out in different ways. And this virus is continuing to circulate here. It's continuing to circulate in many other countries. And unless we stop it circulating, then there's every possibility that it will come back again here as we move into autumn and winter. Thanks for listening. It's been a long haul. Don't forget to comment on the end of the film or raise questions we might be able to address. And support Double Down News, Patreon, the future of broadcasting. The only truth that matters is the truth that hasn't got an ulterior motive. That's here.